If you have an individual who's in this program and the standard of care for medical treatments, for research is informed consent. So if a patient says, if they're even verbal enough to say this, I don't want this anymore, do they have even the right to say this? Or is this forced upon them by the courts, by the institution, by their parents?
So here's how it works, is that we do take into account what the person chooses. And if they some clients will say that they want the treatment, some will say that they don't. And we go forward with what's called a substituted judgment hearing. Every single one of these patients is appointed an attorney. And that attorney is there to represent the interests of that individual patient, which is separate from the guardian and separate from JRC. And the judge has to hear all the evidence about all the other treatments that have been tried. And then the judge substitutes his or her judgment for that of the patient if they're incompetent, if they can't make the decision. And then they decide. And then there are periodic reviews to see if it's effective, and that's how the process works. So we take great care to make sure that that the person's heard, and also this is the same thing that we experience with people that are treated with antipsychotic medications. Many of them would choose not to take the medication, but sometimes you have to have someone make the decision or help them make the decision. So it's the same process.
But that's a lot harder to do, to force medication treatment on a person who doesn't want it. In fact, in some states that's illegal, and in some states this is illegal too. So I'm just thinking that the attorney is not the person getting the shock. I just worry that the kids don't have the ability to express their point of view, which is, not only am I getting this reinforcement for behaviors that I might not even recognize. You know, we're talking about people who don't have good insight, so they walk into the room, you know, they may think, oh, you know, Dr. whoever hates me, and that's why I keep getting shocked. Or whenever I walk into this room, I get a shock. I just won't walk into this room. And they get into this paralyzed place where they can't do anything while they're literally wearing the instrument of their negative reinforcement on their back all the time.
Yeah, and I think that's why context is so important. This is not the only treatment that we're using. We are using a comprehensive educational process. We have a beautiful school with all kinds of reinforcers and rewards. It is a loving and caring environment for each student. And we make very clear to the student what behaviors will result in a GED and what behaviors will result in reinforcement. I don't want people to go away thinking that this is the only thing that's going on. In fact, some of our clients may be receiving treatment with medication. They may be receiving counseling. They may be receiving other alternative therapies along with this treatment package. So I understand the concern. And again, I would invite you that you could come here anytime you like and take a tour. I'd love to show you the program.
Dr. Blenkush, I think we can all agree that these are very difficult situations, but I also think we would all acknowledge that the real concern here would be the potential for abuse with a treatment like this. Either way, I just want to thank both of you so very much for being here today discussing this.